Hi guys, I hope you all are safe. I am Dr. Shruti Ajmera and I welcome you to Brain Vibe. So today we are going to discuss about infectious mononucleosis, which is also called as kissing disease. So basically it's a viral infection. It is also called as glandular fever. It is mainly caused by Epstein-Barr virus, which is called as mononucleosis because it increases your white blood cells count and it can stay in your saliva for a very long time. Other viruses can also be responsible for this. Since it's infectious, the question is how it spreads. As the name itself suggests, it is transmitted through kissing or exchange of saliva. It can also spread by sharing of utensils or toothbrushes or drinks. Rarely, but it can also spread via blood or sexual contact. Now let's discuss about some signs and symptoms. So symptoms can be mild or severe, or some people cannot even notice them, which occurs between 4 to 7 weeks of exposure. It is mainly spread by teens and adults. Fatigue, fever, loss of appetite, sore throat, chills and weakness are the common symptoms. In severe cases, there can be enlargement of liver and spleen also, which can cause severe complications like hepatitis and jaundice and sharp pain in spleen. Viral infections lower down your immunity, so it becomes easy to catch other infections also. Prevention can be done by avoiding sharing of toothbrushes or drinks or utensils and washing your hand often. Blood test, white blood cells count, and antibody test are mainly the diagnostic test for this. Treatment includes a lot of rest, increased fluid intake, and medications for pain and fever. Generally, improvement is seen within 1 to 2 weeks, but if no improvement is seen, then you should consult your doctor. So that's it for today guys. I hope this video was helpful to you. If you like this video, subscribe to our channel and press the bell icon for more updates. Till then, stay fit and stay healthy. Thank you.